This is ASA TV. I'm Sarah Panko, and joining us now is Dr. Mary Dale Peterson. Thanks for joining us. Let's get right into it. So Dr. Peterson, tell us about ASA's strategic plan for 2020 and what are some key highlights that members should know?
Well, our strategic plan follows our mission, vision, and values. Our mission statement is advancing the practice and securing the future. We have 6 strategic pillars in our strategic plan, and these are sort of bucketed areas of emphasis that we put financial and people resources into. So the first one is advocacy, with a major emphasis on truth in advertising legislation. Another is member experience, trying to improve what our members experience. Educational resources, we should be the go-to place for members to get all the education that they may need. Leadership development, this is a relatively new pillar that we were really working on to provide those resources to help our members become leaders, be leaders within their organizations. Then we also have quality and practice management, so we're helping physicians actually deal with all the practice management issues as well as some of the burdens that they may experience with regulation and how to work on those kinds of things. And finally, our newest strategic pillar is scientific discovery, where we really want to emphasize that for the future of our practice and specialty, really the future of medicine and what we can do for patients hinges on that scientific discovery that we need to support.
So Dr. Peterson, there are 5 key initiatives that ASA will be tackling in 2020 as part of that new strategic plan that you were talking about. But can you talk to me about just a few of those initiatives?
Sure, Sarah. Let me talk about a couple of those initiatives. The first one under the advocacy pillar is an economic strategic plan. And so you might ask, well, what is an economic strategic plan? Well, anesthesiologists most know that we have what's called a 33% problem. And this problem goes way back to the 1980s when there was a new formula for physician payment that was developed. And unfortunately, it disadvantaged anesthesiologists. We were actually going back into those studies to look at the underpinnings of that. But to give you an example, the time between induction of a patient and when we're ready to wake them up, that time in between was valued at no more than an office visit, in which we know when we're taking care of all of their vital signs, their blood pressure, their heart rate, we're breathing for them, replacing blood loss, doing all of these things, that's way more than a patient going to an office visit. So we're revisiting that to really try to get the government system to pay more appropriately for the value and the training and the risk and all that we bring when we are in the operating room every day. Another part of our economic strategic plan is really developing new payment models and what's called bundled payments so that anesthesiologists and their groups can be ready for the new value-based payment systems that are already out there, but the government and private carriers are actually pushing even more. And finally, the other part of our economic strategic plan is looking at our perioperative surgical home, but really transforming that into the next iteration of that, which is an interdisciplinary perioperative coordinated care system. And so we're looking forward to educating our members on how they can really be a part of that process. As you asked me before, well, what does perioperative mean? And that means that we really should be involved in helping patients get to their optimal health and understand the risks and benefits of not only the surgery but the anesthetic as well, so that we can get them through their operation and really back to functioning and back home as quickly as possible. The other areas in the economic strategic plan include things like fighting surprise bill legislation. We're all against patients getting a surprise bill, but we also want a level playing field with the insurers, which we feel in a lot of the negotiations may have the upper hand, especially if there's federal legislation that would limit an independent dispute resolution process. So we will definitely be concentrating on those types of areas to make sure that we're getting fair payments for the work we're doing. Additionally, we are actually allocating a significant portion of our reserves to really doing the studies and research and refresh a media campaign. And this won't be focused just to the public. It will be really a more select group of healthcare leaders, policymakers, decision makers, to really understand the role of an anesthesiologist in a hospital system is a critical role, and what we can bring to the table to really improve healthcare and the entire system of care.
Well, those are great initiatives. Thank you so much. And thank you for joining us.